Have you ever thought that the way you sleep at night could be quietly working against your health? Maybe even your life? It might sound dramatic, but according to recent data from the Centers for Disease Control and Prevention, over 70,000 seniors pass away in their sleep each year in the U.S. alone. And while it's easy to chalk it up to age, the surprising truth is this. Many of these deaths are linked not to disease or aging, but to avoidable habits we repeat every night without a second thought. After 60, your body becomes far more sensitive. Your heart, your lungs, your brain, they all require a gentler rhythm and more thoughtful care. Yet many of us stick to old routines out of comfort or habit, unaware that a simple misstep in how we hydrate, eat, or position ourselves at bedtime could silently increase the risk of stroke, falls, or heart failure. So, what are these invisible dangers hiding in your nightly routine? Which seemingly harmless mistake has become the #1 threat while you sleep? And more importantly, what small, smart adjustments can you make tonight to keep yourself safe and thriving? In this video, we'll reveal the 7 sleep habits that are putting seniors at risk right now. And trust me, habit number 2 might just be the most dangerous of all. But don't worry, we'll also show you exactly what to do instead, so you can sleep soundly and wake up stronger each morning. If you're new to this channel, welcome. This is your path to smarter aging, safer nights, and better health. Be sure to hit that like button and subscribe so you never miss a vital tip. And if you're watching from somewhere special, drop your country or city in the comments below. We'd love to know where our health family is growing. Now, let's get into it. These are the 7 sleep habits every senior must avoid, starting tonight. Habit number 7. Drinking too much water before bed. Let's start with a habit that most people, especially seniors, think is totally harmless, even healthy. Staying hydrated. And to be fair, it is essential. Water helps every single system in your body function properly, from your digestion and circulation to your temperature control and brain clarity. It keeps your joints lubricated and your muscles flexible. But here's the twist. Drinking too much water at the wrong time, specifically right before bed, can quietly increase your risk of injury, disrupt your sleep, and even trigger cardiovascular complications. This surprises a lot of people, but once you understand the way your body changes with age, it makes perfect sense. As we grow older, our kidneys begin to slow down in how efficiently they filter and balance fluids. The bladder also holds less than it used to. And perhaps most importantly, the signals that tell your brain, hey, it's time to go, become more urgent and frequent. That's why drinking a full glass of water or tea right before turning out the lights can set you up for several nighttime trips to the bathroom. Now, waking up once in the middle of the night might not seem like a big deal. But for seniors, even a single bathroom trip can pose a serious danger. Imagine this scenario. You're in a deep sleep, your room is dark, your blood pressure drops as you stand, and your legs are still stiff. One misstep, and a fall becomes likely. In fact, falls while going to the bathroom at night are one of the leading causes of hospitalization among older adults, according to multiple public health studies. But physical danger isn't the only risk. Getting up multiple times through the night breaks your natural sleep rhythm. You miss out on deep, restorative stages, those precious moments when your body repairs cells, balances hormones, and clears metabolic waste from the brain. And when deep sleep is cut short, your brain and body pay the price. Over time, this can lead to memory lapses, brain fog, increased inflammation, and even a heightened risk of Alzheimer's or dementia. Let's not forget the cardiovascular angle. When you overload on water right before bed, your heart and kidneys are forced to work overtime, processing and eliminating that extra fluid. For people already managing high blood pressure or heart conditions, this added workload can trigger dangerous fluctuations in heart rate and even lead to nighttime arrhythmias. So how do you fix it? The answer isn't to stop drinking water. Far from it. The key is timing and moderation. Aim to hydrate consistently throughout the day, ideally starting with a glass first thing in the morning, and begin reducing your intake after late afternoon. About 2 hours before bed, it's wise to taper off completely. If you're feeling thirsty closer to bedtime, take just a few sips to stay comfortable, but avoid full glasses. Also, avoid drinks that act as diuretics in the evening, like black tea, green tea, coffee, or certain fruit juices. These increase the urge to urinate and can disrupt your entire night's rest. And if you do need to get up at night, make your bathroom route as safe as possible. Keep a soft nightlight on, remove rugs or clutter, and move slowly. Give your body a moment to adjust before standing fully upright. With just a few small changes, you can protect your body, preserve your sleep, and still enjoy the benefits of proper hydration, without putting your health at risk after dark. Habit number 6. Eating late at night. Let's talk about one of the sneakiest sleep disruptors that almost no one thinks twice about: grabbing a bite to eat right before bed. For many older adults, that evening snack feels comforting. Maybe it's a piece of toast, a bowl of cereal, or even a small dessert after dinner. It's familiar. It feels harmless. But if you're over 60, that late-night indulgence could be silently sabotaging your health, impacting your sleep, your heart, and even your blood sugar in ways that build up over time. As we age, everything slows down, especially our digestion. What your body could handle effortlessly at 30 now takes more time, more energy, and more effort. Late-night eating doesn't just delay rest. It sends your digestive system into overdrive at the very time your body should be winding down and repairing itself. Instead of slipping into deep, healing sleep, your system is still working, breaking down food, managing spikes in blood sugar, and trying to balance out late surges in insulin and cholesterol. One of the most immediate consequences? Heartburn and acid reflux. When you lie down after eating, gravity no longer keeps your food and stomach acid in place. That acidic mixture can rise into your esophagus, causing that burning sensation in your chest or throat. For seniors, it's more than uncomfortable. It's dangerous. Repeated episodes of reflux can damage your esophageal lining, increase the risk of aspiration into the lungs, and even raise your chances of nighttime pneumonia or breathing issues while asleep. And it doesn't end there. Eating sugary or carb-heavy meals late at night can cause a sharp rise in your blood sugar, followed by a crash that disrupts your sleep. Worse still, for those with prediabetes or type 2 diabetes, these nighttime spikes can push your glucose levels higher for longer, making them harder to manage come morning. Researchers have also found that eating close to bedtime keeps your blood pressure higher throughout the night. Normally, your pressure dips while you sleep, giving your heart a much-needed break. But when you eat late, especially salty or fatty foods, that pressure stays elevated, increasing the risk of heart attacks, strokes, and arrhythmias in those already at risk. So what's the solution? Simple. Give your body the rest it deserves. Try to eat dinner at least 3 hours before bedtime. Let your last meal of the day be your lightest. Focus on lean proteins like grilled chicken or fish, fiber-rich vegetables, and complex carbs like brown rice or quinoa. Avoid heavy sauces, fried foods, and anything high in sugar. And if you absolutely need a little something before bed, go with a light snack that supports digestion and sleep, like a banana, a spoonful of almond butter, or a small bowl of unsweetened yogurt. By adjusting when and what you eat in the evening, you're not just protecting your gut, you're protecting your brain, heart, and sleep quality too. And when your sleep improves, so does your energy, your focus, and your ability to stay independent and strong. Your body does incredible things for you every night. All it needs is the chance to rest, without the extra workload of a late-night meal. Habit number 5. Sleeping in the wrong position. Most of us never question how we sleep. We simply fall into the same position night after night. But what if that comfortable habit is quietly putting your health at risk? For seniors, the way you sleep can have a surprising impact on everything from breathing and digestion to heart health and even brain function. Let's start with what many consider the most dangerous position for aging adults: sleeping flat on your back. While it might feel natural or help relieve pressure on joints, back sleeping can actually cause a chain reaction of problems, especially after 60. Why? Because as we age, muscle tone in the throat naturally weakens. That means when you lie on your back, gravity pulls your tongue and soft palate downward, partially closing off your airway. Even if you've never been diagnosed with sleep apnea, this narrowing can reduce airflow to your lungs and brain. You may snore more, breathe less efficiently, and even experience moments where your breathing stops altogether. And the consequences aren't minor. Interrupted breathing during sleep causes drops in oxygen, which puts stress on the heart, elevates blood pressure, and increases the risk of strokes and heart attacks. In fact, a study from the Journal of Clinical Sleep Medicine found that seniors who sleep on their backs are more than 20% more likely to suffer cardiac events during the night than those who sleep on their sides. That's a serious wake-up call. And for those dealing with acid reflux or hiatal hernias, the risks climb even higher. Sleeping flat on your back makes it easier for stomach acid to creep up into your esophagus. That can lead to silent reflux, where you don't even feel it, but the acid still causes damage. Worse, it can enter the lungs, increasing the risk of aspiration pneumonia, chronic coughing, or even long-term esophageal issues. But here's something many don't know. Your sleep position also affects your brain. Researchers at Stony Brook University found that side sleeping, especially on the left, improves the brain's ability to flush out waste through a system called the glymphatic pathway. Back sleeping, on the other hand, reduced this clearance ability by more than 60%. That means toxins and proteins linked to Alzheimer's and dementia may linger longer in the brain, potentially accelerating cognitive decline. Even sleeping on your right side may not be the best option for everyone. For individuals with heart issues, this position can compress the vena cava, a major vein that returns blood to the heart, and may impair circulation slightly over time. So what's the safest, healthiest position for seniors? Left side sleeping. It supports optimal circulation, reduces reflux, promotes brain detoxification, and takes pressure off the heart. But if you've been a lifelong back sleeper, making the switch isn't always easy. Start by placing a firm pillow between your knees to keep your hips aligned. Use another pillow behind your back to prevent rolling over, and consider an orthopedic neck pillow to support spinal alignment. If reflux is a concern, slightly elevate the head of your bed using risers or a wedge pillow to reduce nighttime symptoms. Training your body to sleep on the left side may take a little effort, but the benefits are well worth it. Improved breathing, heart protection, and better brain health, all while you sleep peacefully through the night. Habit number 4, sleeping in a hot room. We all love to feel cozy at night, especially as we get older. A warm blanket, a snug room, and the quiet hush of evening can feel like the perfect recipe for restful sleep. But here's the surprising truth. A bedroom that's too warm may actually be working against your body, and even putting your health in danger. You see, your body has a built-in cooling system that kicks in as bedtime approaches. That natural drop in core temperature is your brain's way of signaling it's time to wind down. It's essential for shifting into deep sleep, the kind that heals your body, sharpens your mind, and supports your immune system. But when your bedroom is too warm, say above 70 degrees or 21 degrees Celsius, your body struggles to cool down. And instead of sleeping soundly, you're likely to spend the night tossing, turning, and waking up without ever feeling fully rested. Now for seniors, this problem isn't just about sleep quality. It's about safety. As we age, our internal thermostat becomes less reliable. That means it's harder for our bodies to regulate heat. We're more prone to overheating, and that can lead to a domino effect of serious health issues. In fact, a study published in the American Journal of Geriatric Psychiatry found that older adults who sleep in warm rooms get up to 30% less slow-wave sleep. That's the deep, restorative phase, where your brain organizes memories, your immune system recharges, and your body repairs itself on a cellular level. Without it, we open the door to all sorts of trouble. When you consistently sleep in a hot environment, your body begins to suffer. You may notice increased inflammation. You might find your blood pressure creeping up. Over time, that sleep disruption has been linked to heart disease, diabetes, and even faster cognitive decline. And it doesn't end there. Sweating through the night, even mildly, can lead to dehydration. And here's where things get even riskier. When the body loses fluids and electrolytes, the blood thickens slightly. That increases your risk of dangerous clots, irregular heartbeats, and in severe cases, stroke. For seniors already living with heart or lung conditions, the added burden of staying cool through the night can trigger complications like chest pain, shortness of breath, or elevated heart rate while sleeping. So how can you stay safe and sleep soundly? It starts with creating a cooler sleep environment. Most experts recommend keeping your bedroom between 60 and 67 degrees Fahrenheit or 15 to 19 degrees Celsius. That's the sweet spot for optimal rest. Choose breathable bedding. Natural fibers like cotton or bamboo are best. Avoid heavy comforters or flannel sheets that lock in heat. Instead, layer your blanket so you can easily adjust through the night. If you tend to get chilly, keep a throw nearby, but skip the electric blanket. It can overheat you while you sleep. A small fan or cracked window can also help circulate fresh air, keeping the temperature stable throughout the night. These changes might seem small, but the impact on your health is big. Better sleep, better heart health, and sharper brain function, all from something as simple as adjusting the thermostat. So, the next time you're tempted to crank up the heat before bed, remember this. A cool room isn't just more comfortable, it's a smart, science-backed strategy to protect your body while you sleep. Habit number 3, getting out of bed too quickly. Have you ever jolted awake, swung your legs over the edge of the bed, and suddenly felt like the room was spinning or your knees might give out beneath you? If so, you're not alone. And that dizzy spell isn't just in your head. For older adults, this seemingly harmless morning habit can be a serious safety risk that often goes overlooked. You see, when you shift suddenly from lying down to standing, your body needs to make quick adjustments to maintain stable blood flow. But as we age, those adjustments slow down. The arteries become less flexible, the heart reacts more slowly, and the nervous system may not respond as quickly as it used to. The result? A condition known as orthostatic hypotension, a sudden drop in blood pressure that can leave you lightheaded, off balance, or even completely faint. This isn't just uncomfortable, it's dangerous. According to a major study in JAMA Internal Medicine, older adults with orthostatic hypotension are significantly more likely to suffer from falls, fractures, and even premature death. And the risk is highest at night or early in the morning, when blood pressure naturally dips and your body is still in a semi-resting state. Falls are the #1 cause of injury-related hospital visits for seniors. And many of those falls happen during nighttime bathroom trips. A single fall can lead to a broken hip, a head injury, or even a long-term loss of independence. In many cases, it's not the fall itself that's fatal. It's the cascade of complications that follow. The good news? You can protect yourself with a few small, intentional changes. When you wake up, especially in the middle of the night or first thing in the morning, don't rush. Take your time. Sit up slowly and pause for a few seconds. Swing your legs over the side of the bed and remain seated. Wiggle your toes, flex your feet, and let your body gradually reorient itself. These movements help stimulate circulation and prepare your blood pressure to normalize. Hydration also plays a key role. If you're even mildly dehydrated, blood volume drops, making that pressure dip even more dramatic. Keep a glass of water by your bed and sip it before you stand, especially if you take diuretics or medications that affect your cardiovascular system. And don't forget about your environment. A dark room and cluttered floor are a dangerous combo. Install night lights or motion-activated lamps to gently light your path to the bathroom. Make sure the floor is clear of cords, rugs, or anything you might trip on. If needed, add grab bars or stable furniture for support. Footwear matters too. Swap out slippery socks for sturdy, non-slip slippers. It may seem like a small detail, but having firm footing can prevent a devastating fall. Finally, review your medications with your doctor. Some blood pressure medications or sedatives can increase your risk of morning hypotension. A simple adjustment in timing or dosage could make all the difference. So remember, getting out of bed shouldn't feel like a race. Those extra 30 seconds to wake up gently could save you from months of recovery, or worse. Slow and steady wins the race, especially when it comes to protecting your health, safety, and independence. Habit number 2. Ignoring snoring, breathing pauses, or insomnia. Snoring, it's something many of us laugh about or brush off, especially in older age. Maybe your partner jokes about your chainsaw snores, or you've simply accepted waking up feeling groggy as a normal part of getting older. But what if I told you that snoring, gasping, or even trouble falling asleep at night could be your body's early warning signal that something far more serious is going on? For seniors, these nighttime symptoms are often dismissed as just aging, when in fact, they could be signs of a silent but life-threatening condition: obstructive sleep apnea. This isn't just about noise or lost sleep. It's about what happens to your heart, your brain, and your entire body when breathing stops repeatedly through the night. Here's what happens. The muscles in your throat relax a little too much, narrowing or blocking your airway. Your breathing may stop for 10 seconds, 20 seconds, even longer. Each time this happens, your oxygen levels plummet, and your heart has to fight harder to pump blood to your brain and organs. These interruptions can happen dozens or even hundreds of times a night without you ever being fully aware. Over time, this puts tremendous stress on your cardiovascular system. Your blood pressure rises, your heartbeat becomes irregular. And according to the landmark Sleep Heart Health Study, untreated sleep apnea increases the risk of fatal heart attacks by 30% and stroke by up to 60% in older adults. Those are numbers we cannot ignore. Even more concerning is how underdiagnosed this condition is. Research suggests nearly 4 in 10 seniors may have sleep apnea, and up to 80% don't even know it. Why? Because we tend to ignore the warning signs. Loud snoring, choking or gasping during sleep, waking up with a dry mouth or headache, feeling exhausted even after what seemed like a full night's sleep, or struggling to stay awake during the day. And then there's insomnia, difficulty falling or staying asleep. While it may seem unrelated, chronic insomnia is often a red flag for deeper issues like sleep-disordered breathing, stress overload, hormonal imbalances, or even early neurological decline. The cost of ignoring it? Poor sleep quality, increased inflammation, weakened immunity, and faster cognitive decline. In fact, studies show that untreated sleep apnea can lead to brain shrinkage in regions responsible for memory and decision-making, at nearly 3 times the normal rate. This directly links poor sleep to a higher risk of Alzheimer's and dementia. And yet, so many seniors still see these issues as normal. But here's the good news. You don't have to live this way. Simple changes, medical guidance, and even technology can help you breathe easier and sleep deeper. If you or your partner notice persistent snoring, pauses in breathing, or ongoing insomnia, speak to your doctor or a sleep specialist. Diagnostic sleep studies can be done at home or in a clinic, and treatments like CPAP therapy, oral devices, weight loss, and sleep hygiene improvements can dramatically reduce your risk. Research shows that properly treating sleep apnea can lower cardiovascular risk by up to 42% in older adults. And just as importantly, it can restore your energy, your focus, and your joy. So, don't ignore the signs. Your body is trying to tell you something. Listen carefully, take action, and give your brain and heart the restful, healing sleep they deserve. Habit number 1, taking certain medications before bed. For many older adults, Taking medications before bed is simply part of the routine, like brushing your teeth or setting the alarm. It feels harmless. A sleeping pill here, a blood pressure med there, maybe a pain reliever for those stiff knees. It's what you've always done, right? But here's what most people don't realize. Some medications, when taken at night, can quietly increase your risk of confusion, falls, and even life-threatening events, especially after age 60. And the more medications you take, the higher the risk of dangerous interactions while you sleep. Let's start with one of the most commonly used: sleeping pills and sedatives. These include drugs like diazepam, clonazepam, and alprazolam, known as benzodiazepines. While they can help you fall asleep by calming the nervous system, they also suppress your breathing and slow your heart rate. That might sound fine, until you consider that many seniors already have slower circulation, weakened lungs, or heart conditions. In fact, a study in the British Medical Journal found that seniors who use benzodiazepines regularly are at much greater risk of nighttime falls, hip fractures, and even early death. The sedation can carry over into the morning, leaving you groggy, disoriented, and dangerously unsteady on your feet. But it's not just sleeping pills. Certain antidepressants, antihistamines, and muscle relaxants can also interfere with the deep, restorative stages of sleep. You may technically be asleep, but your brain is not getting the quality rest it needs to repair memory pathways and support cognitive function. Over time, this sleep disruption can speed up forgetfulness, confusion, and even accelerate age-related brain decline. Next, let's talk about something many seniors take daily: non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen or naproxen. If you're using these to ease nighttime pain, you could be unknowingly stressing your kidneys and liver, especially when used regularly or combined with other meds. These drugs can also increase the risk of gastrointestinal bleeding, which becomes even more serious when mixed with blood thinners or other prescriptions. Then there's the issue of blood pressure medication. While some types are prescribed to be taken at night, for others, it can be risky. If your pressure drops too low during deep sleep, your brain may not get the oxygen it needs. This drop in nighttime blood flow can lead to dizziness, fainting, or in severe cases, even a stroke. A study in the journal Hypertension emphasized how the timing of blood pressure medications directly affects cardiovascular outcomes. And here's something most people overlook: drug interactions. As we age, our metabolism slows down. That means medications stay in our systems longer, and combining certain prescriptions, especially sedatives, painkillers, and antihypertensives, can lead to compounding side effects like confusion, fatigue, or dangerously low blood pressure. Even over-the-counter remedies like nighttime cold medications can have surprising effects when mixed with prescriptions. So how do you stay safe while still getting the treatment you need? The first and most important step is to talk to your doctor or pharmacist. Ask whether your nighttime meds are appropriate for your age and health condition. Are there safer alternatives? Are you taking anything that might be causing drowsiness, dizziness, or memory lapses? Avoid unnecessary sedatives. Many sleep problems can be managed without pills through simple techniques like calming herbal teas, meditation, breathing exercises, or adjusting your sleep environment. If you take blood pressure meds at night, monitor your readings closely and report any changes to your healthcare provider. Keep a medication log or use a pill organizer to track what you're taking and when. And make sure someone in your family or care team knows your medication schedule in case of an emergency. Remember, a small adjustment in the timing of your medication can mean the difference between a restful night and a dangerous one. Protecting your brain, heart, and safety doesn't always mean taking fewer meds, but it always means taking them smarter. As we wrap up this video, it's clear that seemingly simple habits can have far-reaching effects, especially when it comes to sleep. Whether it's turning down the thermostat, skipping that late-night snack, or rethinking your medication schedule, every small change you make tonight can protect your health tomorrow. Now we'd love to hear from you. Have you ever experienced dizziness, grogginess, or confusion from a nighttime medication? Did you realize it might have been the cause? Share your story in the comments. We're building a community where seniors and caregivers can learn from each other and thrive together. And if this video helped you, please like, subscribe, and tap the bell for more expert tips on living stronger, longer, and safer after 60. Your health is your greatest asset. Sleep well, stay well, and we'll see you in the next video.